Have you ever been told that your child needs a crown instead of like a white filling or a tooth color restoration on one of their baby teeth? Well, today we're going to talk about why that might be the case. Well, hey, I'm Dr. John with PDAO. I'm a pediatric dentist here, and today we're going to be talking about why it might be important for your child to receive a crown versus a filling. We're going to go over some indicators that we see in the mouth or on the tooth that would indicate that it may behoove us to place a crown over a filling for the best longevity for your child. So there are multiple reasons that a pediatric dentist or any dentist in general might recommend a stainless steel crown for a primary or a baby tooth over a white restoration or a white filling. So there are some indicators that we look for pretty regularly on x-rays and in the mouth. And so when you look in the mouth and you see what we call cervical decalcification, or basically a band of the beginning cavity around a tooth. Sometimes even if there's not a large cavity present on the tooth, the best restoration for that tooth may very well be a preformed metal crown or a stainless steel crown. And sometimes the best treatment, it's important to keep in mind, is not always the most aesthetic treatment, but we always try to reserve the least aesthetic treatment for the back of the mouth only when it's absolutely clinically indicated. So cervical decalcification is one example that we might need to treatment plan a crown over a filling. Another clinical indicator that might make us need to move more toward a crown over a white filling is if we have multiple caries lesions on the same baby tooth. And so if you have one cavity on one surface of this baby tooth, and then you have another cavity on a different surface of the same baby tooth, the literature basically just tells us that a multi-surface intracoronal or inside the crown white filling does not hold up anything even close to what a preformed metal crown or a stainless steel crown, i.e. cap, could do for the patient. And so that might be another very good reason that your dentist treatment plans a crown for your child. It might be recommended for your child to receive a crown over a filling, even if the cavity is small, but there is something else on the baby tooth. For example, like a developmental defect of enamel, such as enamel hypoplasia or enamel hypocalcification. And basically, that process just looks like there's a cavity on one part of the tooth or on a part of the tooth that has a developmental defect in the enamel or outer layer of the tooth, which makes that tooth less likely to adhere a restoration more predictably. And so the best restoration that adheres to these teeth with these developmental defects is a stainless steel crown. So another really good clinical indicator that would make us need to move toward a crown over a filling for your child would be if we saw a cavity that is what we call extending beyond line angles. And basically what that means is that's terminology stating that you basically have a tooth that is a three-dimensional morphologic shape. You think of a cube, for example. It has 6 sides, and if you remove that one side and you have a 5-sided cube, that is, you don't account for the base of the cube, that's kind of the shape of a tooth in the back of the mouth, especially a baby tooth. And so if you think of it like that, you think of the lines that connect the different faces of the cube. And basically, if you have a cavity that extends from one face of this cube to the other face of the cube in any direction, the literature says that it actually is better to place a stainless steel crown because you're going to have much better longevity than if you tried to do a very large white restoration on that tooth. So yeah, these are some clinical indicators that we see in the mouth or on an x-ray that would indicate your child to receive a crown over a white filling. And so this really is just because we're trying to do the very best for your child and adhere to the best practices of the American Academy of Pediatric Dentistry and give them the best restoration that will last them a very long time.